I'm going to dispense with the usual introductions and do that afterwards. But thank you very much to start with for the opportunity to talk about this with you this evening. It's very refreshing to be able to come and talk about it. We interrupt this presentation with the breaking news, but sadly again, as we were saying, mental health bed shortages are hitting the headlines time after time. I mean, this particular one from the 15th of July, so it's a little bit out of date now, but there was one earlier this week as well. So there's plenty of news being made about the fact that mental health beds are in shortage, that this particular one was on the back of the Independent Commission report being published. Royal Society, College of Psychiatrists are saying the whole system of mental health care provision needs to be improved. It's not just about the lack of beds, but it's also about the system and the information and the way that delayed discharges and so on and so forth are impacting. Now, I don't pretend to have the silver bullet for any of this. I don't think any one person does. But what I'd like to try and get to tonight is to tell you a little bit about, and excuse the pun, one answer to the beds crisis. This isn't even my idea. This was an idea that was talked about last year at the EHI Live conference in Birmingham, and my organisation, Answer Consulting, along with NHS England, sponsored a light bulb challenge, and we were overrun with ideas for good apps and good ideas of improving health informatics. And the one that struck a chord with us when judging the input was this one submitted by Sussex Partnership NHS Foundation Trust, essentially basing it on the late rooms concept. So having something that would give information about what beds were available. Now, as we all know, information is power. So the more information we've got, the more power and control we can have about bed availability. So Sussex, as are many, challenged with that lack of internal bed availability, high administration charges. Teresa Jones, who came up with the idea, said it's on average about £3,000 per day for her trust. So that's coming up towards £1 million per trust per year, and that's just one trust. So there's a huge cost to the NHS in terms of asking patients or moving patients from outside of their area. And the worst case scenario from Sussex up to Liverpool. So late beds as a concept, it would be an online service for sharing bed availability within trusts. They could use it as a bed management facility, but also intra-trusts and between trusts across the NHS, but also private care providers. Because of course, if you're asking patients to go to the private care, then it's costing the NHS money as well. So the system would allow bed managers to search for the available beds, put in the distance constraints, but also the patient constraints as well. So what type of care do they need and what type of bed? And following a successful search, the bed manager can reserve the bed. So it sounds simple, but of course we know that the main issue here would be getting people to use it. So we firmly believe and answer that to have applications that are used, you not only need to make them useful, you've got to make them usable and have the information there. So I want to run through just some screen mock-ups of how it looks, of what we've developed in about 5 weeks in agile sprints at Answer Consulting. And in the break or later on, I've got the link to the UAT, the user acceptance site, so if anyone wants to come and have a play about with it, feel free. So pretty basic stuff really. We're basing it on what would be a very common mobile application or a web-based application system with organisational accounts, so for the East Brighton Community Mental Health Centre, if you can't see that from there, and that would be fairly standard for whichever hospital or organisation that joined in. So this demonstration is going to show you a bit of the account setup, a bit about finding a bed, how you would book a bed, and reviewing the requests. So it's fairly straightforward, and certainly not as academic as my friends, colleagues here. But as a user within the trust, you'd be setting up your own account details and setting up email alerts. This is the bit that's hopefully most useful to those people once they're actually at the system. Typing in any postcode, linking it to some of the data repositories back at HSCIC and Google Maps API and things like that we would then have the patient's GP. And so we can identify the patient's GP by putting in the postcode of their GP. You can then refine it down to the personal demographics of the patient. So what do we need? Patient's 25, they're male, the bed tier is low, and we're going to use the widest scope of 300 miles to see how many beds are available. So within that, then it would come back with a list of the different beds available for that criteria. Of course, you can then change the criteria to narrow or widen the field. And much like when you search for a hotel on Google Maps, you're going to have the different rooms available and different beds available here. You pull back the pricing information, pull back all the various attributes and constraints, and then the idea is that you can make a more informed choice about which bed that you're choosing for the patient and where you're sending them. So clicking on Make Booking within that one would then bring you up to a booking screen. Again, fairly simple stuff really. Patient identifier, that would probably be the NHS number. We'd encourage the use of the NHS number, but of course if it's the organisational details as well. Now the idea here is that this isn't particularly clinical information system, so that we can avoid the need for the major information governance issues. It doesn't necessarily need to be on N3 and things like that. But there's options there, and again, sorry, the resolution is not so good, but you could check a box and say, I'll be sending the clinical information on later. You could do it via NHS mail or through integrated systems later on. So the idea is that you have then a list of the ones that you've requested. You have a list of the ones that have been reserved. You have a list of the ones that are incoming requests from other hospitals to your hospital. And these are all functions that I guess bed managers or bed functionality within the hospital are doing, but they've just not got the information to their fingertips and not got the technology to do it. So a little bit about us, and then to talk about how we feel that it could roll. So we're a 15-year-old company, small, medium enterprise based in Leeds, typically been in the finance industry, so some big named customers in the finance industry, other industry, commerce and telecommunications and retail. And agile development, integration of systems in those sectors has been the expertise of the company. Most recently, I've got a 15-year background in NHS management. We've brought across my colleague Richard, who was up until June this year the lead technical architect at Leeds Teaching Hospitals, and we're building a digital health business within Answer Consulting. So to try and use the capability that this wider Answer team have got to bring to bear some agile development, some quick wins, and some interoperability within systems and integration so that we can start to tackle some of these issues that have been knocking around for a long time. So already the company, before I open up, has done a trust integration engine based on open source components, and that's how they came to my attention before I joined them. And that was at King's College Hospital. So I've got a couple of case studies through on the table through there, so when you're having coffee and tea, please feel free to pick one up and take one away. But it's the first open source platform-based trust integration engine, so it links about 50 odd different systems within that trust. And they've re-engaged us to enhance it to put in their critical care system as well. We've brought agile transformation to the Leeds care record, for their electronic patient record, which they're building internally themselves. And also that's the underpinning technology that joins up the Leeds care record. And we've also with King's developed the first open source spine mini services portal to ping the spine for NHS numbers in real time. And then we're working with what's called Ripple, which is the Leeds Council Integrated Digital Care Record Pioneer Programme funded by NHS Tech Funds to look at an open source integrated digital care record. And as I say, the late beds is another one of our innovations. We're a supporter of this Code for Health programme that I was instrumental in setting up at NHS England. And so we're listed on there as a supporter, so it felt right to mention it to you and bring it to your attention. There is codeforhealth.org. You can sign up as an interested user or as a supporter if you're in industry. It is supposed to be a platform for looking at different systems in healthcare and bringing together the different technologies that could be used to bring about things like applications that might help with your ideas there. A learning network as well, so that people can learn about how coding and informatics can be improved and the general education of informatics and coding. And then to set up challenges as well. So lake beds in a way is part of the challenge area. And what we're doing with Code for Health is trying to generate a community of interest. Sussex, obviously, and their neighbouring hospitals are starting to, we've got executive buy-in for them to look at doing a pilot round. As I say, we've developed it in 5 weeks to have that very simple functionality. What we're now looking for is different areas. So I'm taking up opportunities like this to showcase it and say, is anyone interested in helping with the further requirements phase? And then would anybody be interested in having, being part of this as a hosted service? So as opposed to it being a national service imposed and top down, this is a local service but from a local idea that's hopefully going to grow. So not only with lake beds, but if you have any other requirements or needs for an agile development partner, then please do feel free to contact us. And thank you very much for your time. I hope that's been of some interest and use to you, and happy to take questions.